hemostasis and the factors which are important in blood coagulation. As we have already discussed about the blood coagulation tests in our practical session, so I am not going to elaborate on this part. I suggest you study this part from your textbook, which consists of bleeding time, clotting time and prothrombin time and international normalized ratio. Slide 2. Let's see what hemostasis means. It means prevention of blood loss. Every time a vessel is ruptured, hemostasis is achieved by several mechanisms. A. Vascular constriction. B. Formation of a platelet plug. C. Formation of a blood clot as a result of blood coagulation. And D. Growth of fibrous tissue into the blood clot to close the hole in the vessel permanently. Slide 3. Let's see how the vascular constriction help hemostasis. As you know, vessel wall contains smooth muscle. As soon as a blood vessel has been cut or ruptured, the trauma to the vessel wall causes smooth muscle in the wall to contract. This contraction reduces the flow of blood. The contraction results from A. Local myogenic spasm, B. Local autocoid factors from the traumatized tissues and platelets, and C. Nervous reflexes. Vasoconstriction probably results from local myogenic contraction of the blood vessels initiated by direct damage to the vascular wall. And, for the smaller vessels, the platelets are responsible for much of the vasoconstriction by releasing a vasoconstrictor substance, thromboxane A2. The more severely a vessel is traumatized, the greater the degree of vascular spasm. Slide 4. The other mechanism is formation of the platelet plug. To understand this process, it is important that we first discuss the nature of platelets themselves. Platelets are also called thrombocytes, are minute discs 1 to 4 micrometers in diameter. They are formed in the bone marrow from megakaryocytes. The normal concentration of platelets in the blood is between 150,000 and 300,000 per microliter. Slide 5. Platelets have many functional characteristics of whole cells, even though they do not have nuclei and cannot reproduce. Platelets' cytoplasm are contains of 1. Actin and myosin molecules, which are contractile proteins similar to those found in muscle cells, and still another contractile protein, thrombostatin, that can cause the platelets to contract. 2. Residuals of both the endoplasmic reticulum and the Golgi apparatus that synthesize various enzymes and especially store large quantities of calcium ions. 3. Mitochondria and enzyme systems that are capable of forming ADP and ADP. 4. Enzyme systems that synthesize prostaglandins, which are local hormones that cause many vascular and other local tissue reactions. 5. Fibrin stabilizing factor, and 6. A growth factor that causes vascular endothelial cells growth that eventually helps repair damaged vascular walls. It is useful to know the platelet has a half-life in the blood of 8 to 12 days. Slide 6. Platelet repair of vascular openings is based on several important functions of the platelet. When platelets come in contact with the damaged vascular surface, especially with collagen fibers in the vascular wall, the platelets rapidly change their own characteristics drastically. They begin to swell. They assume irregular forms with numerous irradiating pseudopods protruding from their surfaces. Their contractile proteins contract forcefully and cause the release of granules that contain multiple active factors. They become sticky so that they adhere to collagen and the tissues into a protein called von Willebrand factor that leaks into the traumatized tissue from the plasma. They secrete large quantities of ADP, and their enzymes form thromboxane A2. The ADP and thromboxane in turn act on nearby platelets to activate them as well, and the stickiness of these additional platelets causes them to adhere to the original activated platelets. Therefore, at the site of a puncture in a blood vessel wall, the damaged vascular wall activates successively increasing numbers of platelets that attract more and more additional platelets, thus forming a platelet plug. This plug is loose at first, but it is usually successful in blocking blood loss if the vascular opening is small. Then, during the subsequent process of blood coagulation, fibrin threads form. These threads attach tightly to the platelets, thus constructing an unyielding plug. Slide 7. The third mechanism for hemostasis is formation of the blood clot. The clot begins to develop in 15 to 20 seconds if the trauma to the vascular wall has been severe, and in 1 to 2 minutes if the trauma has been minor. Activator substances from the traumatized vascular wall, from platelets, and from blood proteins adhering to the traumatized vascular wall initiate the clotting process. The physical events of this process are shown in this slide. Within 3 to 6 minutes after rupture of a vessel, the entire opening end of the vessel is filled with clot if the vessel opening is not too large. After 20 minutes to an hour, the clot retracts, which closes the vessel still further. Platelets also play an important role in this clot retraction. Slide 8. In this table, the most important factor of the clotting factors and their synonyms has been shown. As you see, fibrinogen is also called factor 1, and it is one of the important factor which has a role in clotting. Please note that it is important to know the synonyms of the clotting factor. So, I suggest to keep in your mind the synonyms. Slide 9. Here we will see how the process of organization of the clot to the fibrous tissue is completed. Once a blood clot has formed, it can follow one of two courses. One, it can become invaded by fibroblasts, which subsequently form connective tissue. 2, it can dissolve. The usual course for a clot that forms in a small hole of a vessel wall is invasion by fibroblasts, beginning within a few hours after the clot is formed. This process continues to complete organization of the clot into fibrous tissue within about 1 to 2 weeks. Conversely, when excess blood has leaked into the tissues and tissue clots have occurred where they are not needed, special substances within the clot itself usually become activated. Slide 10. In this slide we will discuss the conversion of prothrombin to thrombin. Firstly, prothrombin activator is formed as a result of rupture of a blood vessel or as a result of damage to special substances in the blood. Secondly, the prothrombin activator, in the presence of sufficient amounts of ionic calcium, causes conversion of prothrombin to thrombin. Thirdly, the thrombin causes polymerization of fibrinogen molecules into fibrin fibers within another 10 to 15 seconds. Thus, the rate-limiting factor in causing blood coagulation is usually the formation of prothrombin activator and not the subsequent reactions beyond that point, because these terminal steps normally occur rapidly to form the clot. Platelets also play an important role in the conversion of prothrombin to thrombin because much of the prothrombin first attaches to prothrombin receptors on the platelets already bound to the damaged tissue. Slide 11. Excessive bleeding can result from a deficiency of any one of the many blood clotting factors. 3 particular types of bleeding tendencies that have been studied, which are 1. Vitamin K deficiency, 2. Hemophilia, and 3. Thrombocytopenia. Please study these 3 causes from your textbook. Thanks for your attention, and for your exam please study the slides. Good luck.